You are doing well today. Several questions we are asking today. Our contributing health analyst is Dr. Payal Patel Davlatabadi. She's an associate professor of public health at the University of Evansville. Dr. Payal, good afternoon. Moderna, the vaccine trial, where do we go from here and how long could it take if continued trials show positive results?
Well, phase 1 was just ended and it showed promising results. The vaccine trial was conducted on about 40 people with 8 showing antibodies that were developed against COVID. So this is promising. They will proceed to phase 2, which will test the vaccine on a few hundred, and then phase 3 will be conducted in July, which will test it on about tens of thousands of people. Now, if the vaccine does show promising results, safety and efficacy, then there could be mass production of the vaccine.
What should parents be on the lookout for now? New York, as you know, has already reported more than 150 cases. What do you say?
Yes, this is unfortunate and it is impacting children much more, and it is directly related to COVID. So COVID symptoms, a fever of 4 or more days, and also other symptoms that aren't typically seen with COVID that are indicative of the inflammatory syndrome. So these include abdominal pain, conjunctivitis, GI issues, and even rashes on palms of hands and feet, and also some oral lesions are things to be on the lookout for parents.
Well, Dr. Payal, the Indiana Health Commissioner says the state is seeing a significant spread of asymptomatic cases and is advising people to still stay home if they can, even though the economy is slowly reopening. What do you think?
Yes, there's a big study being done in conjunction with the Indiana state government and IUPUI, and the study actually revealed that at this point in time, up to 180,000 people may have had or have an active infection. So this goes to show you kind of the under testing and also the asymptomatic cases that may be prevalent. So yes, I'm seeing more and more people venturing out. They're not social distancing. They're not wearing face masks or face coverings. And really the guidelines here are, let's just pretend like you are sick and everyone around you is sick. That way we can keep everybody healthy. So it's really important to practice those preventive measures, social distancing, hand hygiene, and face masks, because the prevalence is much higher in the state of Indiana than what we really think it is.
Dr. Payal, you showed me that video from China involving how fast this virus can spread. Now, some research suggests you can spread the virus by simply talking to a person within 6 feet. That definitely got my attention. What about you?
Yes, and this is especially true if you're indoors. Now, if you're outdoors with free-flowing air, it's probably not an issue, but if you're indoors, just by talking, if I am infected, I can spread aerosols, and this can remain in the air for up to 14 minutes. Some studies have been done where people spoke and the aerosols traveled as far as 9 to 11 feet. So this is very interesting information. And again, those preventive measures, they're very essential in keeping us safe and healthy.
Things have just changed so dramatically, Dr. Payal. I was on a business trip to New York City last October, and I'm trying to imagine how it could reopen considering its density. Is it going to be very tough for larger cities like New York City, even Indianapolis, Louisville, St. Louis in our region, to reopen?
Yes, this is going to require significant planning by the government to reopen in a safe manner. I know New York City has taken many steps and many precautions, and they've hired, or they're currently training over 400 contact tracers. So if someone were to get sick, they can trace those contacts and they can quarantine. So isolation, quarantine, testing, tracing, prevention is all a comprehensive approach that's going to be involved in order to safely reopen.